This lady came to me a week after she was taking care of the wound in the not most optimal manner. And despite that, we were able to help her quickly heal this second deep degree burn. And what you can see is the first day, right after first 24 hours, it got less red and was already granulating. And here you can see this is 4 days after, almost completely healed, and 17 days after 5 treatments.
This is incredible. I came in with a second-degree burn, and in 5 days, it's absolutely gone. There's no scarring. It looks incredible. I'm so grateful to the doctor. Just unbelievable.
This lady, what's amazing about her case is that she has darker hair, darker eyes. Normally, after such a burn, you would have this was also a second degree burn. This happened from an explosion in her face of something she was cooking with. And it will leave a permanent pigmentation, usually a hyperpigmentation that would last for months, and you'd have to use bleaching creams. And you can see 5 days afterwards, there's absolutely no mark. Now, in her, she was coming every single day, and that's why I was able to get it to resolve faster. Also, certain areas like the face, they tend to heal faster than the lower extremities the further you go from the heart. There are a few things why you see faster results, but the key was also that she was coming every day for the therapy. This is another lady. She came only 2 times, and you can see her before and 2 weeks after a treatment, both with IV and with topical therapy. And you can see she came back a month afterwards. She was using just some topical anti-inflammatory creams, and you can see a little bit of small erythema, minimal pigmentation, but for the most part, it's really remarkable. And again, you can see before and 1 month after, and it will continue to improve. This lady came to me a week after. She had this ulcers on her face that were expanding, getting worse. And you can see 24 hours after 1 treatment and 4 days after 3 treatments, you can see how fast it healed. And you can see that in magnification before, 24 hours after, and this is 4 days after. Every day she would be coming for the injections again. Before, 24 hours out, and 4 days after 3 injections. So this is after each day having injections, 3 sessions, and topical therapy.
So one of the things that I find incorrectly being taken care of in the hospitals, emergency rooms, urgent care, and unfortunately also by some physicians is burns. If you go to the hospital, the first thing they'll tell you when you have a burn is to apply Silvadene. And while Silvadene is effective with its antibacterial element, it is not the most conducive for allowing the healing of the wound in a faster manner that will lead to less scarring. If you have a burn and it is from any material that causes a blister, you want to right away apply topical steroid or take oral steroid or other anti-inflammatories. Now you may say, okay, if I do that, I'll get an infection. But think about it. If let's say you spilled boiling hot water, you use hot water to disinfect things. You don't get an infection from the hot water. You may get an infection from afterwards when there's an open wound by touching it with dirty hands because the defense has broken down. But you don't get it from the hot water. You don't get it from a chemical burn. We use chemicals to do a chemical peel on the person's face. We do it to disinfect things. So you don't get it from that, and you don't get it from an electrical burn. You get it from secondary infection once the gates are open for the bacteria to enter and they win in their battle against our immune defense system. So once you have that inflammation, the next thing that will happen is you'll have scar formation. To avoid the scarring, you will take some oral or topical steroid, and then hopefully you won't even get the blister formation. When I was a kid in Israel, I remember my grandma used to apply high potency topical steroid on my sunburns. Back then there were no sunblocks. People would put baby oil. I refused baby oil, but I would still get sunburned in Tiberia when I was there in Israel. Either that, or she would put the sour milk, kefir. You can put aloe vera. But the main point is you don't put baby oil on that, because that's what they tried to give to my daughter when she had a burn from fireworks. And you try to make sure that if there is a blister that's already forming, you don't unroof the blister. But what you do is you deflate it. Because if you don't deflate the blister, the fluid continues to collect and expand along the weak spot. And the weak spot of the skin is right where the epidermis connects to the dermis. It actually looks like the shape of egg carton. So if you look at the egg carton with ups and downs, it has like pegs where the epidermis is stuck to the dermis, and this way it doesn't shear off. But when you have the fluid collecting underneath, it slowly separates and dissects with the pressure and makes the blister even bigger. So if you deflate it by putting big enough opening in it, you use a 18 or 16 gauge needle in a sterile manner, a little alcohol, pop it through the blister, the fluid will leak out, and then the skin will remain as a bandage. It's nothing better than that skin as a bandage to take care of that wound underneath, and the air will go in to allow the skin to slowly underneath replace it, and when the time will come, it will replace it. Now, if by mistake you put your pants, you ripped it off, what do you do then? Then what you want to do is you want to keep the area constantly lubricated. One of the things you don't want to do is what people tell all the time, well, use soap and water. So soap and water is good as an antiseptic, but soap is a detergent and it's a base. So that will cause the pH to be elevated. pH goes from 1 to 14, 0 to 14, 1 being acidic, 14 being basic. The skin pH, healthy skin pH, is anywhere from 4 to 5.5 pH on the acidic level. This promotes healthy microbiome, healthy bacteria on your skin, which help fight the unhealthy bacteria and allow the skin to properly heal. When you're using anything that will increase it, whether it's the bacteria that will cause it, the dangerous bacteria or the bacteria that are actually causing the infection, the pH goes higher, and that makes the cells that are supposed to fight less functioning, less able to function properly. So we want to keep the pH low. One of the best things that's been proven to work well is Vashi, and Vashi has a pH of about 5. And this is a little bit acidic, and when we're doing it, applying it on the wound, we're promoting the necessary climate for healthy bacteria and for immune system to do its job to better protect and heal the wound. And so this lovely lady had a burn a week ago, and I saw her yesterday. We applied the Vashi because she was not doing the stuff correctly on the wound. She was using it as often as she could with soap and water, which dries the skin. Now, when you dry the skin, what happens also is it becomes like, it doesn't become supple, and it starts cracking, and that prevents the skin from being able to properly heal. Also kills any healthy cells that are trying to migrate into that area in order to regenerate. So you don't want to do hydrogen peroxide, you don't want to do soap and water on this gentle wounds unless they're infected. If you have got some asphalt, some dirt going in there, you want to wash it at the beginning, but then you don't want to overwash it. So once you do that, the next thing is you want to keep the area well lubricated. If you can, one of the things that I like to do now with the new technology is to use certain growth factors that are specifically helpful in regenerating skin. In the past, I used to use platelet-derived growth factor beta, which is produced in the lab and sold under the name called Regranex gel. And I've been doing that since 2000 for wounds to heal. Now, unfortunately, we're in November 20th, and they're still a month out from getting it back, so they're out of stock. I guess I made it very popular. Whatever, but the stuff is about $1,300. That's what the cost of that tube is, and you have to keep it refrigerated for a 15-gram tube. So what I do instead is I use something called exosomes. Exosomes they come from different stem cells. The most effective exosomes are the ones that are taken from the placenta, from the umbilical cord, mesenchymal stem cell derived exosomes. And the growth factors there are specifically most effective to provide normal development of the embryo that develops into a healthy baby. They are tested for the variety of diseases, including some rare things like Ebola, dengue fever, not to mention the regular hepatitis, HIV, etc. And the baby healthy, mama healthy, weight healthy. They remove that jelly that surrounds the blood vessels, which is the one with the highest concentration of the exosomes, and then the periumbilical, right? And then they do centrifuge it and give them a special size. The one that specifically we're using are from 50 to 150 nanometer size, which is about the size of the COVID virus. And we inject it into that area. What it does is it tells the cells over there what they need to do, number one. Number two, it gives them the necessary substrate, the necessary food, so that they can do their job better. And so we're going to do it right now. And if I will show you the picture, how the wound looked just yesterday and how it looks now, you would see quite a huge difference. You can hold this for you here, and I'll just take the gloves, and you can see this is just after one session of applying it. And I hope in 5 days this will be mostly already healed if she does it daily. Of course, we're approaching Thanksgiving, unfortunately, but you can see that, and you can see how it looks today. It looks already much better. Now let me explain to you what is better, because you may not realize it. So if you look over here, see those little tacks? That's the egg crate that I discussed. And if you see here, it was much more denuded. You can already see that it's starting to fill up. So this was a stage 3 in some areas, stage 2. It's already starting to fill up much faster. And now as I'm going to inject it, I'm going to see how it feels. And definitely also much less red, much less irritated. No steroids being used here. This is just the growth factors and a special cream that contains growth factors as well. If you liked the episode and found it useful, please let us know by liking us and leaving a comment. Thank you.